use the lowest effective dose for as short time as possible. There are some acidic diet. I was wondering, how is that going to work? Because I thought the body is just going to neutralize, whatever in bicarbonate, like tablets, to actually regulate that. However, with vegetables and fruit.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of the Kidney Coach and co-founder of Kygenesis, a range of supplements designed for people diagnosed with chronic kidney disease. And I'm delighted to be joined again by becoming very fast one of my favorite guests, the beautiful Therese. Therese is a consultant pharmacist, health strategist, and wellness researcher who specializes in bridging the gap between traditional medicine and functional health strategies. She has a keen eye and knowledge on chronic diseases such as kidney disease, metabolic syndrome, high blood pressure, and she provides practical science-based solutions that empower individuals to take control of their health. What else do you want to add or say, or that you think people need to know, and even healthcare providers listening, that need to understand when it comes to the triple whammy and chronic kidney disease?
So I think the three factors, like we mentioned, like hydration, because that's going to dilute the urine and reduce the risk of crystal formation. I think it's also about avoiding high doses. So anybody that has been on methotrexate, which is used for rheumatoid arthritis for years, and as time goes by, your kidney function changes. So you might be on the same dose, 10 milligrams once a week, like for 10 years. However, your kidney function might have declined or changed. So it's important to actually get it reassessed and to use the lowest effective dose for as short time as possible. There are some cases where, the methotrexate, that you can alkalize the urine with bicarbonate, and that seems to actually help reduce, because methotrexate can cause, crystals, and that can obstruct the tubules in the nephrons. And that's one way we can actually manage methotrexate toxicity. The other thing as well, I think, is a healthy lifestyle. It's interesting that in kidney health, it's the only one area, apart from endocrinology, where they really specify in their guidelines that your diet, because if your kidney is kaput and you have metabolic acidosis, which means your kidney can't do its job of regulating homeostasis, the balance, or alkalinize the system. When you ingest protein, that's going to increase acidity. So you need to help the kidneys to actually regulate and make it more neutralized and more alkaline. So I've heard people tell me, because in the past, a diet, alkaline or an acidic diet, I was wondering, how is that going to work? Because I thought the body is just going to neutralize, whatever we eat. But the fact to the matter is, when your kidney is declining, it cannot actually help, regulate the pH. You need to give it a bit of assistance. And currently in chronic kidney disease, they do give sodium bicarbonate, tablets to actually regulate that. However, with vegetables and fruits, can do the same thing if we actually balance it. So interesting how health can be really simple. Like cut out the processed foods, add in your fruits and vegetables. And I like to say at least 2 cups of vegetables for 2 meals a day at the very minimum. And that's just going to help regulate homeostasis and reduce that toxic acidic environment that can be quite inflammatory.
No, I totally agree. It's often, sometimes we overcomplicate things. So are there any things that you want to reiterate to anyone listening about the triple whammy, or healthcare providers, that you think is really important, that other people are going back to their healthcare providers and saying, I'm on this triple whammy, I've got kidney disease, my EGFR's dropped, I'm concerned? What are some of the tips that people can take away and relay to their healthcare providers to make sure that this is taken seriously and really looked at?
I think if we actually can detect chronic kidney disease early, we can increase sort of the preventative, there's a point of no return when you actually let the problem linger. And then the fire has already burned and damaged all the forest. You can't actually regrow it. So I think the most important thing is to get a kidney health check. know your blood pressure, what the numbers are. Make sure that you know your whether you do a P test, see whether you got any protein in your urine, which is the most common way to actually identify chronic kidney disease. And then get a blood test to figure out like how high your serum creatinine is. Get a baseline on a regular basis, and if you got a family history of like kidney conditions, things like kidney stones, you need to go and get it checked out because you're higher risk.
Mhm.
And we know like some things like, if you're a practitioner, like high doses of vitamin C, it can precipitate kidney stones. And then with kidney stones, like a low oxalate diet can make a big difference. So again, it comes back to actually being aware of what you have. So I think having the courage to actually get checked out makes a big difference. Like if you've got any pain around the area where the kidneys are, the back area, get it checked out. I think is the key thing. And even vitamins and acids, which we use for reflux, like calcium can cause problems and people with kidney problems. But if you don't know you've got kidney problems, you continue like the whole damaging process, that fire keeps going on. So I think early prevention is crucial. Get it checked out, know your numbers, and then you'll be in a very good position to live a happy and healthy life.
Thank you so much for being on the show. If you want to know more about what we do, head to www.kidneycoach.com. You'll find us on Facebook and Instagram under the same handles. And remember to hit subscribe and like. That way you'll get notified anytime we put up more content. And if you have any questions for Theresa, put them down below and I'll be sure to pass them on to her. Thank you again for coming back on and sharing your wisdom and knowledge and for being such an amazing pharmacist. I really appreciate you.
It's a pleasure.
All right. Thanks, everybody. Bye.